Okay, so students, we are going to start with the dissection of the anterior abdominal wall. This dissection has been already done by Dr. Hemkiran, who is now busy doing this recording, and I am showing that. So work is done by Dr. Hemkiran, I am taking the credit of explaining it. Right, so don't forget that this is all done by Dr. Hemkiran. Okay, so first we have to give the incision in the anterior abdominal wall. One midline incision is given like this, right? And this has to go around the umbilicus. This is an important landmark, that's why we are preserving it. Then horizontal incision is given at the level of GP sternum on both the sides. Then lower horizontal incision is given along the inguinal ligament. You know the attachments of inguinal ligament, I need not tell it. So this incision was given along the inguinal ligament if the body is intact. In this case already the lower limb has been dissected, so it is already given. So after that we reflected the skin on both the sides. So skin has been reflected like this, right? On both the sides skin is reflected. Underneath that what you expect is the fatty layer of superficial fascia, which contains enormous amount of fat plus the various cutaneous nerves and cutaneous vessels. The cutaneous nerves in this region are the anterior primary rami of T7 to L1, T7 to L1, right? I told you in the previous lecture that umbilicus is at the level of T10. So here the T10 will be coming, here the T7 will be coming, and in between 8 and 9, here 11, T12, that is subcostal nerve, and in this region will be L1, right? So that is how these are spliced. Now these are the anterior primary rami. You know what are the anterior primary rami? Spinal nerve that is formed by the dorsal root and the ventral root. Then the spinal nerve is formed, that is dividing into anterior and posterior rami, that is ventral and dorsal rami. So ventral rami will be coming from the posterior side like this. They will be going along with like this, and then they will be coming up to here. Now here in this region, they will be giving the lateral cutaneous branches. Lateral cutaneous branches will be emerging from here and then divide into anterior and posterior branches like this. This is one of the lateral cutaneous branch, right? So this is one of the lateral cutaneous branch which will be coming over here, and then it will be dividing into anterior and posterior branches. Similarly, after that they will be coming over here. Here in this region, just in the paramedian region, they will be piercing the deep structure and coming out. When they come out, they will come on the skin in the superficial fascia fatty layer. Then they will be dividing into medial and lateral branches. They will be splying the skin in this region, right? So some branches will be coming, that will be anterior cutaneous branches like this. This is one of the anterior cutaneous branch, one anterior cutaneous branch. So these are the anterior cutaneous branches. So that is the cutaneous nerve which will be present over here, right? After that, we find the membranous layer. After reflecting the membranous layer, which is gone with this skin, you find the external oblique muscle, which is the outermost layer. Now this external oblique muscle, this is the direction of the fibers of external oblique. It is just like when you put your hands in the pocket. It is just like this. That is, they are going forward, downwards and medially. This is the direction of the fibers of external oblique. Now, when we talk about the muscle, we should know what is the region, what is the insertion, and then actions and the nerve spread. Its region is from the lower 8 ribs. These are the lower 8 ribs on the lateral aspect, lateral surface, and the inferior borders of the lower 8 ribs, right? Then it is going downward, forward and medially, as I have told you. You can see the direction of these fibers. It is going downward, forward and medially. Now, out of this, the uppermost fibers which are coming from the upper of the lower 8 ribs, you can say rib number 5 and 6, those fibers will be going transversely like this, while the lowermost fiber which are coming from 12th rib and the 11th rib or the 10th rib, they will be going vertically downwards like this. But in this case, I have reflected it, there almost all of these are going downward, forwards and medially, right? Where are they going? These fibers, they will be going down like this. When they are going down like this, they will be inserting into the outer border, outer lip of the ventral segment of the iliac crest. You know the iliac crest, we have studied in the lower limb. It has got two segments, ventral segment and the dorsal segment. Ventral segment has got three lips, outer lip, intermediate lip and the medial lip, right? So it is the outer lip, its anterior 2/3 where this will be inserted. After that, in this region, it will be forming the free border. Here will be the free border which will be enrolled upon itself like this, which will be enrolled upon itself, and here it will be forming a groove over here. So lower border will be free, and this constitutes your inguinal ligament. So inguinal ligament is the lower free border of the external oblique aponeurosis, right? Then it will be attached here on the pubic tubercle, then pubic symphysis, pubic crest. And if you see in this region, here are the present muscle fibers, but after this, beyond that, it has turned white. That means it has turned into an aponeurosis, and direction of the fibers in the aponeurosis is also same, that is downward, forward and medially. So it will be muscular in this region, and beyond that, towards the medial side, it will become aponeurotic, right? So this aponeurosis will be at the lateral border of the rectus sheath, which will be the next class. Here will be a rectus sheath will be formed. Here it will go into the anterior wall of the rectus sheath, and in this linea alba, here will be linea alba, where these fibers will be decussating with each other. So these fibers which are at the lateral border of the rectus sheath, they will be passing, all the fibers will be passing in front of the rectus sheath, and they will reach the linea alba, where they will be decussating with the fellow of the opposite side. So these fibers will be coming like this, and after decussating at linea alba, they will be going like this, right? And from this side they will be coming like this, downward, forward and medially, and here they will be going downward, forward and laterally. So they will be decussating like this, right? They will be coming to this in the formation of the linea alba and the rectus sheath once again. So that is about the external oblique, right? That is about the direction of the fibers of the external oblique. Now what is left is about the inguinal ligament. I will be coming to that shortly. Now after this we have reflected the external oblique. This is the external oblique now. After that, this muscle is the internal oblique. Can you see the direction of the fibers of internal oblique? It is upwards, forwards and medially. In this direction it is going. See the direction of fiber, upward, forwards and medially. I am comparing it. External oblique was going downwards, right? And it is going upwards. So they are at right angles to each other. These two muscles are at present. Their fiber, direction of fibers is right angles to each other. Now what is the region and insertion of this internal oblique? Internal oblique is taking region from the intermediate lip, where their external oblique was inserted. That was on the outer lip. This is on the intermediate lip of the iliac crest, anterior two-thirds of the ventral segment. Plus it is taking region from the lateral two-thirds of the superior surface of inguinal ligament. Inguinal ligament, what was that? That was the lower free border of external oblique, right? So it will be taking region from here deep to this, in this region. And erasing it, so you can see internal oblique taking region from this ligament, right? So it will be coming from here and going in this direction. So this is all internal oblique taking region from inguinal ligament. This is so if you see, I am reflecting the external oblique, it has been reflected. Now this is internal oblique taking region from the intermediate lip of the iliac crest, ventral segment, anterior two-thirds. Plus this was the inguinal ligament, it is taking region from the inguinal ligament, that is the lateral two-thirds. Its direction of fibers is upwards, forwards and medially. Then where it will be going? We again going to the lateral border of the rectus sheath. Here it will be dividing into two lamina, superficial and deep. Superficial lamina will be going in the superficial part, that is superficial to the rectus abdominis muscle, this is the rectus abdominis, and deep lamina will be going deep to it. That is, if I reflect it, this one will be the deep lamina. Here is the deep lamina of the internal oblique, which is present deep to the rectus abdominis muscle. That will be taught you again in the rectus abdominis and its rectus sheath, right? So that is the direction of internal oblique, and it will reach again in the midline, that is in the linea alba. There it will again cross the midline and go in this direction, right? So when it crosses to the opposite side, its direction will be like that of the contralateral external oblique. External oblique is coming from this side, direction of fibers will be like this. Internal oblique direction is like this. When they are crossing, they will be going like this. So their direction will be parallel. Internal oblique of this side, external oblique of this side, they will be parallel to each other. Similarly, external oblique of this side and internal oblique of this side, they will be parallel to each other, because on the same side they are at right angles to each other. So that is about the internal oblique. Now internal oblique, apart from this, this is going to the opposite side, decussating with the linea alba. After that, some of the fibers will be going here in the lower, that is 5th, 6th and 7th costal cartilages, they will be attached over here. Now its region, I have told you, it is from the iliac crest and from the inguinal ligament. Also it is taking region from this fascia over here, that is called sacral-lumbar fascia, which is present primarily on the back. So that is taking region from outer surface of that also. We will be studying that in the exposure of kidney from behind. So now I have reflected the internal oblique. This is being reflected, right? This is the internal oblique. I am cutting it from here, internal oblique, right? So deep to that is another muscle, that is the transversus abdominis. Can you see the direction of the fibers of transversus abdominis? It is transverse. As the name indicates, it is transverse. So what is the region of this? It will be taking region from again the sacral fascia, that will be continuing over here, plus in this region again from the iliac crest. Now which lip it will be taking region? Of course the medial lip. Outer lip, external oblique insertion, middle lip or the intermediate lip, origin of the internal oblique. Medial lip will be the origin of transversus abdominis. That is the ventral segment, anterior 2/3 or 1/3. Then it is taking region from the lateral 1/3 of the inguinal ligament here, right? So this is the transversus abdominis. Its direction of fibers is transverse, right? And then it reaches again the rectus sheath. Now, in the rectus sheath, where will you think it will be going? It will be going in the posterior part, in the posterior to the rectus sheath. Posterior part of the rectus sheath will be formed by it, right? So in the rectus sheath, in the anterior wall, it is formed by number 1, external oblique, number 2, the anterior lamina of internal oblique. While the posterior sheath of the posterior wall of the rectus sheath, that will be formed by posterior lamina of this internal oblique and whole of the lamina of transversus abdominis. It means 2 laminae are in the anterior sheath, 2 laminae are in the posterior sheath. In the anterior sheath, it is the external oblique plus anterior lamina of internal oblique. In the posterior part, it will be posterior lamina of internal oblique plus the whole of the transversus abdominis. So that is about the transversus abdominis, and it is taking region from the cartilages over, lower cartilage over here also, and then it is going in this direction. That is transversely. So this is the aponeurosis, and this is the muscle. So 3 muscles I have told you: external oblique, internal oblique, and the transversus abdominis. So the 4th muscle is the rectus abdominis. This is the rectus abdominis. It will be taken up again by you in the by Madam Kaushal in the class of the rectus sheath. Now this rectus sheath, rectus abdominis muscle, it is taking region from the it has got 2 heads. They will be medial and lateral head. They will be taking region from pubic tubercle and pubic crest and pubic symphysis, right? And then these fibers are vertical, going upwards, and they will be inserted into 5th, 6th and 7th costal cartilages. Now, when this dissection was done, midline incision was given over here. Not midline means, does not mean the midline of the body, midline of the rectus sheath. So this incision was given over here, then horizontal incision at these 2 levels, and then it was reflected like this. When it was reflected, can you appreciate at the level of umbilicus, some zigzag lining is here. At this zigzag lining, it was attached with the anterior sheath, and one over here and one over here. One at the level of 6th, 7th, this episternum, and one at the level of umbilicus, and one at in between these 2. There may be one lower to that also, but these 3 are very constant, right? Now these represent the lumbar ribs. Number 1, lumbar ribs. Number 2, they represent the segmental origin of this muscle, so that the fibers contract in between over here, so that they have got more number of fibers, and this makes the muscle more strong, right? So that is the importance of these. What is this called? Tendinous intersection. These are called tendinous intersections. Okay. Now, so that is about the rectus abdominis muscle. Now, another muscle which is present over here is the pyramidalis muscle. That is pyramid in shape. This is the pyramidalis muscle. Can you see this triangular muscle? A small triangular muscle, right? You can see its fibers are going upwards and medially. Now, this one. This muscle. This one is the pyramidalis muscle. Now this pyramidalis muscle again rising from the pubic crest, pubic tubercle, fibers are going upwards and medially, and these are attached on the linea alba, right? Now other name for this pyramidalis is the expressor vesicae utralis. That is, and it is also called tensor linea alba. Tensor linea alba means it is tensing the linea alba, making it tense. And second is, it is helpful for expressing the urine, that is from the urinary bladder. This is what the name has been given to, these 2 names have been given to this pyramidalis muscle. Now, it may show variations. It is ending over here, it may be absent, it may go right up to here, that is between the umbilicus and this, in between the 2, it may go up to here, or it may be absent, or it may be very small, absent on both the sides, absent on one side. So these are the various variations which may be seen in the pyramidalis. That is about the pyramidalis. Now another muscle is the crematoric muscle. The crematoric muscle will be taking origin from here, that is inside the inguinal canal. It has got one lateral head and one medial head. Lateral head will be taking origin from the interfoveolar ligament, which is present over here. We'll be studying that shortly. Or it may be taking origin from the fibers of internal oblique and this conjoint tendon. We'll be studying it shortly. Then these fibers go downwards around the spermatic cord on its lateral side. See, this one is the spermatic cord. This one is the spermatic cord. It is going towards the testes and towards the scrotum. So these fibers, lateral fibers, will be present on the lateral side of it, and they will be forming the loops around it. Just focus over here. So they are coming on the lateral side, they are going like this. They will be forming loops around it, go from the posterior side and then go on the medial side. Some fibers are coming from the medial side, they are coming like this. So both of these fibers will be joining with each other. Then they will be going below the testes also. Below the testes also they will be forming the loops. They will be going from lateral side and joining with the medial side. So when this muscle will contract, this is present around the spermatic cord, this is present around the testes. When this muscle contracts, region and insertion is here, forming the loops like this. When this will contract, what will it do? It will pull the testes up. So testes will be pulled up. Or scrotum will be also pulled up. So that is the basis of the crematoric reflex. When you stroke the medial side of the thigh, what will happen? This reflex action will pull the testes up. That is the crematoric reflex, right? Why it happens so? It is just like the testis feels that something is going to injure it and it is retracting back towards the abdomen, right? So that is the action of this muscle, that is crematoric, right? So that is about the various muscles. I have told you 6 muscles: external oblique, internal oblique, transversus abdominis, then rectus abdominus, pyramidalis, and this crematoric. So you must go through these muscles. Only then you will be able to understand the next class of rectus sheath and inguinal canal. Now, what I have not told you just till now is the inguinal ligament, right? I will be telling you this in the next audio recording with the bone with me, because I will need that. I am just going to gather the bone and we will be starting again about the inguinal ligament, right?